See, and we are live. Good morning, good afternoon, good evening, depending on where and when you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan. I'm excited again to do another Facebook Live with you, our viewers watching live hashtag and in replay hashtag. And today we're talking about the phrase, Doc, I have diabetes. How do I keep my feet? I'm very honored and excited to have the one and the only Dr. T, literally Dr. T, beautiful, easy name to pronounce, who is here with us as our guest. Hi, how are you? And thank you for coming.
Good morning. Well, it's good morning in California. Almost lunchtime, really.
um, Thank you for coming. And I know I already introduced you as as far as your name, but could you tell our viewers who are you and what do you do?
Yes, I'm Dr. Tea Nguyen, and I'm a podiatrist. So I specialize in foot and ankle, and I love taking care of feet from all ages, from when they come out of the womb to the end of days as well. And I also specialize in limb preservation. So, in particular, people who are at risk for an amputation, which includes people who have diabetes, peripheral neuropathy, or even circulation problems. I love taking care of those people and helping them understand preventive measures to preserve their limbs and stay active.
Awesome. I like what you do, Doc, and I like that you do from essentially from the cradle to however old someone is. That's awesome. I do see your posts. I do. I love how engaging you are about the preventive aspect, and of course, you do surgeries as well. So that's also the whole gamut. So I love what you
Mhm.
do, and thank you for what you do. Okay. Now my next question is this: so you one can tell just listening to you that you love feet, and that's why you.
In a different way, because people might take that wrong.
So I'm like, but why podiatry? What was this about podiatry that intrigued you?
Podiatry is such a small profession in itself, so it's not well known just yet. And that's what got me really excited was that there was a potential pathway to increase awareness about foot care. And after all, our feet are the last to be paid attention to. It's the most neglected body part. And we don't know it's a problem until something hurts or something needs surgery. So when I got into podiatry, I saw a huge potential on how we can also not just be the doctor, but also as a public advisor in helping people understand the quality of health, how to stay healthy, and then what to do if you had to undergo some kind of surgery to maintain wellness.
Awesome, awesome. It is a small subset, but it's a very important subset, especially from our patients who are diabetics. Now, let's talk how does diabetes affect the feet? And I ask this question because whenever I tell patients, "Well, make sure you show your feet," and they're looking at me, why? So please, can you enlighten us? Why? What's the big deal with feet and diabetes?
Yeah, what is the big deal with feet, right? So here's an exercise. If you don't really know how valuable your feet are, try walking around with just one and see how far you can get. That's how valuable and underappreciated feet are. And so that's kind of the exercise I try to share with patients is in understanding the feet, you need both. One is not a spare. So you can't mess around, be negligent, and expect if one goes, well, I still have one more left. Really, they're of equal weight. You need them both equally to be optimally functional. So I try to help people who have diabetes understand as soon as they're diabetic, connect with the podiatrist. Because the easiest thing you can do is just understand your own anatomy and look at your feet every single day, the same way that you might look at your hands or your face, just to make sure everything is clean, there's nothing suspicious, there isn't an unusual growth, or maybe you stepped on something and didn't realize you got a cut or an infection or an ingrown toenail. So, the first thing I always try to share with people who are newly diagnosed diabetic is pay attention to your feet. What does it look like today? And pay attention to it after you shower. Did you find moisture between the toes that created an open sore? Did you step on something and you have either a callus, a wart, or a new skin lesion that could be a melanoma? So that's why it's important because you need to know what your body looks like to
Mm.
understand what's abnormal and then to seek intervention for that.
Awesome, awesome. So, um, what, why not the hands, right? Um, what is it about diabetes that tends to target the feet? Like, why? What would you say? Someone say, "Well, I don't really look at my hand." You know, you do subconsciously, you do pretty
Yeah,
often. But what is unique about the feet? Would you say to a
yeah.
diabetes watching?
So somebody who has diabetes, about 50% of those with diabetes develop some kind of neuropathy. And
Mm,
it's happens in the feet and the hands, but it's more unique in the feet because we're walking on it every single day. So every step you take is a pressure point. And if you have neuropathy, you may not recognize you stepped on something that created an open sore, or that your shoes don't fit well, they're too tight and they're creating a blister. And
mm,
we're so dependent on our feet. You literally take one step after another that adds pressure to a place that we can't even see, which is the bottom. That's where we get into a lot of trouble if we don't even know what's happening on the bottom of our feet. And we're not flexible. We're not all flexible enough to see the bottom of our feet.
mm,
So a lot of my patients, they may have had back injuries, hip replacement surgery, the knees don't bend really well anymore. And so they can't even lift their foot up to see the bottom of their feet. And that's what makes it really unique. There's a biomechanical issue that goes from the hips to the knees to the ankle. And even your eyes, when you're diabetic, you can develop retinopathy or blindness. So then you can't even see your feet anymore.
hmm, hmm, hmm. Thank you so much for explaining that. And I like how you put it in perspective too. Especially the comment you made before about how try walking around with just one foot. So, and it's good to know what your feet looks like normally, so you can recognize when it starts to change. Um, Now, what are things to look out for? Let me ask this question first. Are there shoes to avoid as a diabetic?
Oh, shoes. Oh my
Yeah.
gosh. How many
Yes.
different shoes we have on earth? Especially now that we're living in a fashion forward type of environment where we're really buying shoes for what they look like rather than what they do for us, right? We're looking at shoes that are pointed, they're narrow toe box, so your toes are all squished. And when your
Mm-hmm.
toes squish, you can develop calluses to the side of your foot. You know, your bunions can accelerate if you have that bump sticking out already. If your shoes don't fit well, you can get a hammer toe or a callus at the tip, or your nails get really thick and they pop off. So a lot of things can happen when we don't wear shoes that fit our natural anatomy. So shoes that diabetics should not wear, you probably should not wear flip-flops. I think if we had to name one culprit, I mean, barefoot walking is a whole nother story because there's barefoot movement that, we're like, oh, all shoes are bad, but it's not black and white in that way.
Okay.
That's practical. We need to wear our shoes to go to work. We can't just walk up in a store and not have shoes on. So the practical side of that is you need some kind of shoe that fits your natural anatomy. And if I had to get rid of one pair of shoes, it would be the thong flip-flops because they are a tripping hazard. They have no actual support, and they're not really protecting a whole lot more than the bottom of your foot. They're not protecting the top for things to fall down on.
Mm.
So that's kind of my bias about flip-flops. I see a lot of trouble, and they're so cheap, and which is why everybody has them. They're like $2, $3 or something. So you get what you pay for, essentially.
Mm. That's a good way to look at it. Now, what would you say for someone who's thinking, well, I love shoes, and in addition to that, I I love having pedicures. So is there anything as someone who's diabetic or pre-diabetic or worried about issues with the foot? Is there anything that we should be more cautious about when it comes to getting a pedicure? Because some people have to get pedicures because it's
Yes,
life.
I love me a good pedicure, so I'm very particular about where I go. So I don't want to take the luxury of a pedicure away from anyone who has diabetes. You can have a quality life. You just have to be a little bit more mindful about
Hmm.
where you go for a pedicure. So they're not all made the same, and they're not all legally licensed to do certain things that they're doing, like shaving off a callus, for example. So you want to go to a place that has a good reputation, a solid reputation with repeat customers. And how do you look for that? Well, these days you can just look online. on Google ratings and just kind of gauge the average experience somebody may have. I think a better way to go about that is talking to your podiatrist in your community and seeing who they refer their patients to, because they have a higher expectations for what these nail salons are offering. So I only refer people to places I go to where I can observe their sterilization techniques and their instruments. They're packaged, they're not pulled out from a drawer with, we don't know if it's used or not. And I know their reputation well enough because they're within the community, they've been well established and other people talk about them. So I have two very specific places that I will refer all patients to if they ask, where can I go for a really good pedicure? And another thing to look for, I think, is just the cleanliness of the facility you're going to. Like, are you being treated like a number where they're shouting across the room and they just are rushing through their clients and trying to see the next person? Or are they taking the time to pay attention to you because you are their only most important client at the moment? Because if you're going to a place that's super busy, they're going to rush you, they're going to accidentally cut you. You might be sharing a tub that's not well sterilized in between. So those are some issues I think about when you go to a place that looks very unkept and they're super busy to the point of they're not really paying attention to their client right in front of them.
Wow, you've said a lot of gems. I took some notes here. And one of the key things you said is connecting with your podiatrist and asking them who would they recommend also as a way to find a good place to get your toes done. Thank you. My next question is this. What are ways to protect your feet? You alluded to some earlier in regards to kind of shoes to wear, but what are ways to protect your feet even with diabetes?
Ways to protect your feet. Shoes are great. I love shoes. And there's a misconception that expensive shoes are better. I mean, there's a gradient, right? Cheap shoes, you get what you pay for. We know that.
Sure.
There's the middle of everybody else that is very practical, it's functional, and it serves you well, like running shoes, work boots, and so on. And then at the end of the spectrum, we're looking at luxury brands that have high heels, maybe even the red bottoms. And we think, well, my shoes are really expensive, they're probably good for my feet. And those two things are very independent. They're probably expensive because they're catering to a different clientele, not because they serve your foot a functional purpose. So just keep that in mind. Pay attention to the type of shoes, what it's doing for your feet. Because if the shoes that you wear were expensive and they still cause you foot pain at the end of the day, then maybe they're not really good shoes after all. Do you have red bottoms? I'm just wondering.
I don't, but I do like I like Jessica Simpson's brand. She has very colorful patterns, but sometimes they hurt. And then during COVID for a whole year, I didn't have to wear heels because scrubs and everyone was comfortable. And when I put my feet back in heels, OMG, that was rough. So I'm kind of anti heels at this point. But very, very good point. Very important to know that the shoe is serving you a good purpose and not actually causing more damage, regardless of the cost.
Yeah, and the shoes have to fit the function. So you can't wear flip-flops to Disneyland and walk for 12 hours a day. That is a bad idea. You can't even do that in Converses or Toms, those flat shoes that don't give any support. You can fold them in half and stick them in your pocket. Those are bad shoes for walking. Whereas if you wanted to walk to your mailbox, you can wear them just fine. So shoes have a function. So just know what shoes you're wearing for the function you're intending on doing.
I love how practical you are. This is good. All right. So someone's wondering, all right, Doc, we get it. Our feet important. How do I check my feet? Like, what am I looking for? And I also want you to kind of, because there are people who tend to feel like, their feet are like, the ugliest things on earth because they look, stubbly and little. But that aside, honestly, like I don't like my feet. They look bad, so it always looks bad to me. But what are things really to pay attention to when checking out your feet?
Let's start with a foot model. I just have these laying around, and it's only half a foot. How sad is that, right?
Oh my God. Love it.
So when you look at your feet, like, are their toes where they're supposed to be? Are they in their own lane? Or are they kind of crossed over? Or are they floating up? You know, those are all functional problems where if you wear a shoe, you can create an open sore, it rubs the wrong way. So just looking at the general anatomy, all of these toes need to live in their own lane. That's one thing that you can look at. What's easy to look at is your skin too, the quality of the skin. Is it intact or is there openings or is there bruising or are the veins very visualized? Are the nails of good quality? Do they look smooth or are they jagged and yellow and thick? You know, that could be an indication of nail fungus. Is there blood under the nail? That could be hematoma or subungual hematoma where there's a lot of blood pressure causing a blood blister essentially under the nail. That might be a shoe thing or an anatomy thing. Some people, you know, you walk with your toes on the ground. Some people's toes curl to the point where they're walking on the nail.
Oh,
So
wow.
just knowing what normal is, straight toes, skin that's intact, nail that looks clean, like almost magazine clean. Now there are variations, so I don't want to be, you know, very militant about what it's supposed to look like. If it doesn't hurt, leave it alone, right? Unless you have diabetes, at least get evaluated because you have diabetes, you may not feel your feet. Then you don't really know what normal feels like. So that's where a podiatrist can really help guide you on what is your normal and what is not abnormal or something to look out for.
Awesome. This has been really, really good. I've been reminded of a lot of things, so this is good. I also wanted to add the hair. I have patients who shave the hair off their foot, and having hair on your foot that falls off on its own is also another warning sign to kind of watch out for.
Yeah,
This,
so the hair on like the knuckles you're talking about, right?
yeah. So when they
Yeah.
have,
So that used to be an indicator of circulation, but we found that not having hair on your feet is a late indication.
Mm,
So it's not until your circulation is really bad that it doesn't grow anymore. So it's a late finding.
okay.
Earlier findings is discoloration. Does it turn pale
Mm,
more frequently, maybe in the cold?
mm.
Um, does it blanch and then come back? You know, the cap fill time, that's a really quick test to see what your circulation is like. And even the subjective sensation of my feet feels cold all the time is that those are earlier indication of circulation problems. And the hair is important, but that's the last stage as well.
Last thing to check for. So really important to
Hmm.
take care of your feet,
Hmm.
both of them, because they may
If
be
you have
trying
both, it's yeah.
because they may be trying to tell you something. Thank you so
Hmm.
much, Dr. T. This has been very, very informative. And I'm sure people are watching and they're like, I like this doc. I like the way she explains things. She breaks it down, makes it easy to understand. And they're asking, we know you're in California, but how can people connect with you? Where can people find you?
Oh, if you want to find me, I'm all over chronically on Instagram. So start there. I'm at Dr. T Podiatry, DRTEA Podiatry. And you can also visit my website if you would love to come by and be a patient at 831feet.com. 831 is the area code for Santa Cruz County and Monterey County. So visit me there as well.
Awesome, awesome. Thank you so much. This was so good on a Saturday. I appreciate you taking the time to come on out.
I appreciate it. I want more people to love their feet. So let me help.
You're an advocate for feet all the way and through and through. Awesome, awesome. Thank you once again. Thank you for those who are watching live and those who will watch this in replay. Please share it. Remember, sharing is caring. And if you or anyone you know is looking for an awesome, a passionate, a thorough family physician in the Mansfield area, I am she. Have a good one and happy Saturday. Bye.
Bye. Thank you.
You're welcome.